Back at it, folks. Good afternoon to everybody. It's Kevin Wood back at Spur of the Moment, the Spur in Southampton, the space for innovation. And I'm very, very excited and honored to talk to our guest today, Dr. Eachempati, Soumi Eachempati. Did I get that right, sir?
Yes, that's right, Kevin. Thank
Fantastic.
you.
Pleasure to have you. I know you're talking to me from New York City, and the Spur is all about innovation, and we're going to get to that in a minute, but I want to first of all commend and thank you for your service. I understand you were in literal retirement. I know you run an innovation company, if you will, a software company, but you're actually serving during this COVID-19 epidemic, correct?
Yes, I am. I'm volunteering as an ICU doctor back in the hospital where I worked for 20 years. They have been very busy. They need extra ICU doctors. I saw they had a calling for it, and I was happy to volunteer and help these patients. This is unprecedented, this crisis, and I'm happy to help.
You know, I'm interested, and I think our viewers would be interested from a real frontline view. We're thanking our healthcare workers, and I'm thanking you, of course. What are you seeing that's different than anything else you've ever seen before?
Sure. And first of all, I want to say that, I'm happy to help, but there are people who have been there longer than me and will be there after me for months to come. And so they really are the heroes here. And the ones taking risks, the ones who were there when we didn't know what it was. And as we were learning about it, they were the ones who were finding out information, sometimes the hard way, about the disease. And so the main thing I'd like to say that I've seen that I hadn't seen before is the volume of people who are critically ill with lung pathology, all in the same setting. I mean, this is public information, there's literally over 1,000 people on ventilators in New York City. I mean, that is just unprecedented. I mean, in the polio era, they didn't have numbers like that. And so
The reason I asked that, we're 5 weeks into this, and you're getting a sense of people either disputing numbers. I don't want to go too far
Sure.
down a conspiracy path, but there are people that I guess they're losing patience, they're losing their minds, they're bored, why are we doing this? The summer's coming. So good to hear. Not good news you're telling me, but you're confirming the reality of what you've seen.
No, this is real. I know it's easy for people to be impatient. They're sitting at home. They may have no understanding of the disease and no relationship with the disease. I know two people who have died who are my age,
I do too.
around 50 years old. And one of them was about the healthiest person I know, I have to say. And so it's real. This is real. And I know it's very New York centric, and there's a lot of other people who are saying that they're not in New York City and so they don't see it. And there may be some minor hospitals in the area that have a few patients, but this is real. And I think that what they should learn from New York City is that it can come to them. New York City had schools open till early March when they thought it wouldn't come to them. And so everyone should take a lesson, not say it's not real.
What do you see in the actual disease that allows it to spread so quickly?
Well, it's the disease, and this is, from CDC and experts. The reason the disease is spreading so quickly is because asymptomatic people are sometimes the most heavily contagious people. And that is part of the scary thing. It's like no one is uncertain that somebody on a ventilator in a hospital can be contagious. They obviously can be. But the asymptomatic people who are going in society, going to the beaches, going to schools, congregating in Manhattan bars are the one who spread this.
Yeah, that puts it in perspective. Thank you. So you're in retirement. You live on the East End. You're part of this beautiful community of innovators, many who've been in the city. I know Ashley, founder of the Spur, is in the city, made a life with his family. Let's talk about that relationship with the Spur, the innovation, and of course the product that you have developed and are now developing further.
Sure. I'll start with the Spur. So the Spur is an innovation hub in Southampton, as you already mentioned, and I had already had a previous relationship with Ashley through mutual friends, and as we became to know each other, he was interested in digital health, and I had a major healthcare background. I was a doctor in trauma and a director of the ICU and trauma for one of the hospitals and medical schools in the city. And importantly, I was also a professor of public health and ethics. And that really made me understand from a population standpoint how diseases can affect populations. I was most interested in it from a trauma perspective, because trauma is a disease that's really a different type of pandemic. We don't think of it as one, because it's not a contagious disease. But on the other hand, a certain amount of people will die every year from trauma diseases due to population issues. And so I was very interested from that standpoint. And I've used that knowledge to understand a lot of different things about diseases and emergency rooms and overcrowding. And now I've used that knowledge to create our latest product with our team, and that is Cleared for Work.
Now, Cleared for Work came from a previous product that you developed a few years ago called Flu Checker.
Actually, I'll give you the full background. Our first product was a product called Go-No-Go, which was used to prevent ER overcrowding.
Yes, I read that and I like that. Yes.
Right. Go-No-Go, or go or not go to the ER.
Go or not go, right, to the emergency room, right.
And so that product was created because I was finding, and as all my doctor friends were, we were becoming the point person from friends and extended family to the questions of, I have X or Y problem. Should I go to the ER? Should I call my doctor? Can I let it go for a while? And we thought, doctors are getting these types of questions all the time. ERs are overcrowded. They're charging exorbitant amounts of money for people to come in and get over-tested for what it turns out benign disease, things that if they actually called somebody on the phone, they would not order all these tests. And so we created an app for that, and it was successful, and it did well. And then we created Flu Checker in the last few months. As soon as we heard about the virus in Wuhan in December and January, we created Flu Checker from that. And from Flu Checker, we created Cleared for Work, which is the product we now want to launch, which is for employers who want to bring their employees back to the workplace safely.
I didn't realize Flu Checker, this is all happening within the last 5 months easily, right?
Right. We work on the fly.
You should. I like it, especially with apps, right?
Yes.
So let's talk about that. Cleared for Work, both an app and a desktop application, and basically it is for municipalities and employers, which,
right,
quite honestly, I see a great need for right now. I read it's HIPAA compliant. That's sort of like the number one question people usually have. How does my employer,
right,
how much do they know about my detailed privacy? So let's start there. Cleared for Work. Is it up and running? Is it in testing? What should an employer know about?
Sure, it is up and running. We have a full-time sales force of 3 individuals who are, as we speak, currently talking to employers and government officials to try to integrate it into different systems. As you mentioned correctly, it is HIPAA compliant, which is actually a very important thing to consider. HIPAA compliance has a long list of technical issues, and such as the data is stored and de-identified. It requires 2-factor authentication for data entry, as an encrypted database, and has to be logged in a certain way for audit purposes through keystrokes. It's very technical. The important thing that employers will have to realize is they will need the permission of employees to get the data, and we don't see that as an obstacle. And initially there was an issue about that from employers, but we basically explained the following. The employees want to feel safe in the workplace, and this is the best way. They don't want somebody sitting across from them to be sick. They don't want somebody sitting across them to even give them an illness. Supposing they have diabetes or hypertension, one of the other vulnerable areas, they may have lupus, they may be on steroids. They may have an elderly parent at home, and they don't want to get a disease in the workplace that could afflict someone else. They could have a diabetic child. No one wants a disease to spread to them. And so I think that most employees will see that the best thing to ensure their safety and the viability of their businesses is to buy in.
It's sort of like the old adage on computers, garbage in, garbage out. You have to have the whole of understanding that this is the best for everyone if everybody participates. Now, it would be true, though, that employee A doesn't necessarily know that employee B is infected.
That's right.
However, the employer can make a decision with the infected employee together based on this. Am I correct?
Well, we want to take some of the particular decision-making out of the uncomfortable areas for the employers.
Yes.
So a lot of it is automated. And also, I think people will realize that the guy in the cubicle or girl across the cubicle who doesn't come in on a certain day does not mean they have the disease.
That's
It
right.
could mean that they had an exposure in their household. It could mean that they just came back from a business trip in Quincy, Illinois, and there was a recent outbreak discovered there. It could mean that they were at a meeting. If you remember early on, Biogen had a meeting in Boston where multiple executives and people from the company all over the country were affected. So it could mean that they were just somewhere where there was an outbreak noted. So there
Right.
won't be necessarily a stigma to not coming in for work. It just means that they may have had exposure to the disease. And I think that will make people realize it's for the safety of everybody.
I understand. The magical question that's asked every day as we pin ourselves to the news channels is, when will it be okay? Part of what you're doing answers that. Is there a longevity beyond this COVID? Do you see, as a doctor, I'm asking you professionally, even if this is over tomorrow or May 30th, are we in a new age of infection?
I think we are. This is not a cold anymore. A contagious illness is not a cold anymore. It is something that can destroy your life. It can be lethal to you and your families. And we in America were fortunately fairly protected from the SARS and MERS outbreaks earlier this century. But that cost a lot of lives in different cities and different locales, municipalities in the world. And we also read the statistics, and we've heard them all, in that up to 50, 80,000 people can die from the flu every year. And while a lot of those were people who were fairly vulnerable that we did not see as young, viable adults and people who came into our workplaces, I think there is a role for this product in businesses, in flu seasons and cold seasons, and nobody wants to get a disease anymore.
Not one that
I've
kills you.
always been a germaphobe and understood infectious disease very well and washed my hands very, very religiously. And being a doctor, I thought that was the right thing to do. I think now people realize that's the right thing for everybody to do.
Absolutely. So we're at April 18th right now, 2020. I'd love to just kind of demark that right now.
Yes.
If you were to give some advice for the average person in New York City, in Long Island, the epicenter, so to speak, from this point going forward, what would that advice be? Do you agree, by the way, with the mask walking into a store, for example?
I think that I am less convinced that the mask prevents infection. However, it does prevent some degree of protection. The other thing, I think it mainly projects an era of social distancing. When you see a mask on, you end up keeping 6 feet from them. So that's
true.
good.
That's
and
true.
You end up not touching your face as much. That's good. Because I think, and a lot of people would say that a lot of the virus is spread in contact of your hands, followed by, it's a two-step process, followed by touching your face, mouth, nose, eyes.
Right.
And I think that happens less when you have a mask on. So I think the mask does effectively work on
indirectly.
2 levels.
That's a good point.
Yeah, maybe not in the necessarily the spreading of the contagion, because theoretically, not everybody's wearing N95s that would prevent complete egress of the virus into the aerosolization. But I think it does have a purpose.
Fantastic. What else would you like? Now let's go over to the employer side of things. People that are making decisions to get people back to work. I'm looking on my left here at Cleared for Work, and I just want to say that's cleared4work.com. I see there's a request a demo. There is a contact form. Just speak about that so we can get the word out on this valuable product.
Sure. I think there's a lot of misinformation out there. There are, and we're encountering it. And I just want to clarify a couple things. So first of all, some people are thinking erroneously that testing is a solution to this crisis, meaning there's 2 types of tests. You can test for the antibody through a swab and eventually saliva. And there's also an antibody test. And people are thinking, if I test negative, I can go to work because that means I don't have it. Or if I had the antibody test and I had already antibodies, meaning I had a low level case of it, then I am in the clear. And both of those are wrong. Meaning if you test negative now, that doesn't mean in the next 2 to 4 weeks you're going to not get it. It means, and you can't just keep repeating the test. The test is very uncomfortable. There's not enough tests to go around still because you can't test 300 million people in this country, and so every week. And so
Right.
the test is not a solution. The other test that people are talking about is the so-called herd immunity test. And if you haven't heard the term, I'll explain it to you.
I know it well. I personally thought I was so high on this concept the first week, but it can be dangerous. I understand for a country our size, but go ahead.
Right. So the herd immunity concept is that enough people out there have had a low level affliction of the disease, and it just minimizes the number of people who can carry it or get affected in the future, and the disease will die out, meaning each person will not be able to give it to one or two people. For that to work from a statistical population health standpoint, you have to have at least 30 to 40% immunity that's documented. Now, there's 3 population tests that have happened. One is in Wuhan, the epicenter in China, and one is in Iceland, and one is just recently published in Santa Clara, California. All of these population studies demonstrated less than 5% of the population had the virus exposed to them, even in Wuhan, which we thought would be like the New York City of there, meaning 30 to 50% or more would be having antibody positive. So that won't work either. So basically, if you count both tests together, and I'm trying to say this as simple as possible, 95% of the people will not be affected by testing having a solution.
Okay, I understand. Wow, that's great information. Thank you for that. Is there any country that's small enough where that test does make sense? Have you seen herd immunity work?
Right. Well, they were hoping Iceland was that country.
Right.
And Iceland had less than 1% test positive because it's a fairly small country. They can really test a fairly good sample of the whole country. And they have one big center, which is kind of the geographic center of the whole country. And it failed there. So if it failed there, it will fail almost everywhere in theory.
Excellent, Doctor. We completely support what you're doing here at the Spur. We feel honored that people like you are developing things at a timely rate, at a really timely rate. This is real time, so keep up the good work. I just want to talk a little bit about the platform where people can go to, if you would.
Sure.
They would go to cleared4work.com. And what
That's
can
correct.
they do on that website right now? What would you like them to see if they're an employer needing this?
Sure. If they have any questions, they can go to the website. We pretty much outline what the problem and the solution are. The problem is that we can't wait for this COVID to be eliminated. It is there. Until there is a 100% vaccine like polio and smallpox, people in the city, every city, are at risk for exposure. Since it's out there, we cannot put our lives away till the vaccine happens. That's 12 to 18 months down the road. Because of that, we are going to eventually have to get back in society in some fashion. I mean,
Right.
offices may not be at full capacity. There may still be social distancing. People may still be wearing some masks, but there will be still some exposure during commutes. You may have family members. Your kids will go to school. The kids will still be carriers. And people will need to be monitored in some fashion so they don't have the disease or have risk for exposures. This is just one way, which we think is a great automated way for employers to do their monitoring, because I think a major feature of risk of exposure will be in the workplace. And we've already heard it's in the grocery stores, it's in the churches. The workplace is also going to be in that category. And this is a way for employers to minimize and mitigate exposures in their workplace. Because if they don't, there will be employers whose businesses will be destroyed with an outbreak. We've already just heard about the Smithfield plant in South Dakota.
Yeah.
And that is just a disaster. And that can happen anywhere. If it can happen in South Dakota, that can happen anywhere.
Absolutely. Just really fantastic information on an unfortunate situation. So thank you again. We'll keep in touch with you because things change here hourly, certainly weekly. And thanks for your time. Have a great morning.
Thank you, Kevin. Enjoyed talking to you. Take care. Bye-bye.
Take care now.